complex, questions you on big time. This question deals with a safe and effective care environment. Okay? This question does. Because what they want to know is, do you know what to look for? That's why, there was a question, somebody came up and said, fluid and electrolytes, do we really need to know that? The answer is yes, you do. Because you need to know with what to monitor the patient for. You need to know how the body functions so you can monitor the patient. You need to know what could potentially go wrong. Okay, we no longer can follow this thing, oh, the doctor ordered, so I do. We can no longer do that. In Florida, there was a case where the patient was a DNR. The two nurses who happened to be from the Philippines called the doctor to say he's not eating, he's not drinking, and he's a DNR. The doctor said, fine, leave him alone. Don't start an IV, don't do anything, leave him alone. They did, the patient died, the family sued. Not only did the family sue, they were brought up on charges of manslaughter and murder in the second degree. Yes. Okay? The doctor was manslaughter, the two nurses was murder in the second degree. Their defense was they were following doctor's orders. It doesn't fly in the United States. You need to know what you're doing. Because the patient was a DNR simply meant don't resuscitate. It didn't mean don't feed. It didn't mean don't start an IV and hydrate him. It didn't mean any of that. But because the doctor said to the nurses, don't do anything, don't feed, don't do anything, and the nurses went, fine. And the patient died. Doctor, manslaughter. Nurses, second degree. Okay, does that wake you up a little bit? Okay, you need to know. It's important. Low back pain is the answer here because one of the signs and symptoms of a bleed, of the aneurysm that could possibly be dissecting is low back pain. Okay, and it's the same thing. And what happens is that if low back pain is the same symptom that you would look for in a blood transfusion. Okay? When scheduling a patient for a cardiac angiogram, which of the following questions would be important? Now, you're scheduling the patient for cardiac angiogram. Okay? So it's not like you got to take him now from the ER to the cath lab. You're scheduling him for it. Which of the following questions would be important? When was the last time you ate? Did you complete your enemas? Are you taking any oral anticoagulants, and how much did you drink today? Okay. When was the last time you ate? You're scheduling him for a cardiac cath, maybe cardiac angiogram, maybe down the road a little bit. So is it important to know when he last ate today? No. Does enemas have anything to do with cardiac angiograms? No. Oral anticoagulants, does that have something to do with it? Absolutely. The patient needs to be off the anticoagulants. Okay. Now it is up to the doctor. Heparin, you can stop right now. As soon as you stop heparin, within 30 minutes, it's gone. It's out of your system. It's very, very fast. Okay, particularly the heparins that we're using today. Coumadin, however, is longer life. It's 5 to 7 days. So generally, they'll tell you to stop the Coumadin for 5 to 7 days before coming in for a cardiac cath. Okay? 68-year-old male, status post CVA, has a hemoglobin of 11, hematocrit of 33, very low serum albumin, and he's refusing to eat. He has a poor appetite. Which of the following is the patient at risk for developing? Dehydration, pressure ulcer, hemolytic anemia, or malnutrition. He has an H&H of 11 and 33. Okay, is that very bad? It's a little low. It's not that, but it's not that bad. Okay? As particularly he's not eating. He has a low serum albumin. What does that tell you? If he has a low serum albumin, albumin is your number one indicator of nutritional status. Okay, so if he has a low serum albumin, what does that tell you? He's malnutrited already. So he's not at risk of developing malnutrition. He already has malnutrition. Okay? So, he's refusing to eat. He has a poor appetite. He's at risk of developing what? He also has a CVA. Pressure ulcer is your answer. Because he has a CVA, so he can't move. Low serum albumin, that means he doesn't have good nutrition. And what does that tell? What is a risk factor of that? Especially if he's immobile. Okay? Pressure ulcer is your answer. It's not hemolytic anemia, because hemolytic anemia means what? That the red blood cell lyses, it ruptures, it bursts. Well, none of this can cause hemolytic anemia. Okay? Again, if you don't know what hemolytic anemia is, go back to your books. Make a note yourself. I need to check hemolytic anemia. Here we go. This is NCLEX again. Now, NCLEX wants to know that you may not be performing these tests. You may not be actually doing the cardiac cath, and you may not actually be doing the cardiac angiogram, okay? But they want to know that you know what the procedure is, so that you can anticipate possible complications from the procedure. Okay? So what we're going to cover is a few of these procedures. We're going to cover the Holter monitor, the cardiac cath or the angiogram, the CVP, which is the central venous pressure, cardiac enzymes, and the thallium imaging procedure. Okay? Those are the questions that the latest and greatest, they love to ask you those questions. The Holter monitor. Well, what is the Holter monitor, first of all? Is it an invasive procedure? No, it's not. It's not invasive. It's a procedure that actually is very benign. Well, why do we utilize the Holter monitor? What's the purpose of it? We want to record the electrical activity of the heart for 24 hours or longer as he's performing his normal routine. And we use it simply because the EKG that we know when a patient comes in and says, I had chest pain, right? And you do an EKG, well, the EKG may or may not pick up the problem. Okay? The thing about the EKG is it's a very good tool because it can tell you the electrical activity of the heart. But the downside of the EKG is that unless the event is occurring right now, we're not going to get it. We're not going to capture it. So he can come in and say, my heart was skipping a beat yesterday. Well, the EKG today won't get what happened yesterday. Okay? And it won't get what happened an hour from now either. So that's the purpose of the Holter monitor. It's benign, just little patches, just the same as an EKG, and you hook it up to a little machine that's about the size of a tape recorder. Okay? What you want to tell him is that it's really important that he wears, first of all, he can't take a shower while he's got this Holter monitor on, all right? But it's very important that he has a little log with him, a little book. In this book, he has to log down everything that he does while he has the Holter monitor on. Okay? 6 a.m., woke up. Okay? 6:30 a.m., took a dump. So, everything, right? 6:45, brushed my teeth. Things like that. You also want to tell him, explain to him why he's using this Holter monitor. Explain to him what the uses are. You also want to tell him, please don't use an electrical blanket while you have the Holter monitor, because what will happen is that he'll come back and he'll, when he returns the Holter monitor along with the reading, it'll look like he was in V-fib for like 8 hours. That doesn't work. Okay? So no electrical blanket. If he sees the light come on in the little Holter monitor tape recorder, then what he needs to do is just push each electrode right in the center, because it could just mean that something's loose. All right? Now, if he brings back the Holter monitor and then it's evaluated and they say, well, he would probably do good with getting, maybe his antiarrhythmic drug that we're giving him right now is not working, so maybe we want to change it. Okay? We can also use the Holter monitor again to evaluate whether this change in medication is working or not. So it's more than just capturing rhythms that we missed, that we couldn't catch with an EKG. It's also to evaluate some antiarrhythmic drugs. We will also put patients who have just recovered for an MI on the Holter monitor, and that again is to make sure that the medication that we gave them, when we send them home after the MI, that the medication is working. Okay, so this is a very nice non-invasive procedure. And we can detect palpitations, and we can detect chest pain, what happens with the chest pain also. And we can detect causes sometimes, because let's put it this way. Let's just say that he documented 6:45 taking a dump, and then you look at 6:45 and he's got the slowing of the heart. Guess what he could be doing? Valsalvaing, right? He could be doing, right? He's having a bowel movement, so he's really straining. And what happens when you really strain? What are you doing when you strain? You're doing a Valsalva maneuver. Yeah. And that slows your heart down. Remember the vagus nerve? Slows your heart down. Okay? Maybe he's saying, okay, I'm brushing my hair. Okay? 7 o'clock, brushing my hair. And again, the heart slows. Well, guess what this does? This is also a Valsalva maneuver. Did you know that? Yes. When you raise your arms over your head, you tend to hold your breath a little bit. And then if you're brushing your hair, guess what happens? Yes, that too. You hold your breath. So that's a Valsalva maneuver as well. In point of fact, where do most MIs happen? At home, right? And where exactly? What room in the home? In the bathroom. And what activity? Taking a shower. Taking a shower, washing their hair. That's when MIs occur more. You all were going to say taking a dump, right? I know you were. No. I could see it all over your face. You were trying to be polite. No. Taking a shower. Yeah, trying to get clean, shampooing the hair. That's right. Okay, nursing care for Holter. Before he puts the Holter on, you've already told him that this little tape recorder logged the activities. One of the other things you want to tell him also is to wear a loose, a shirt that buttons down the front. You don't want to put a sweater on, pull over, because then you got wires sticking out under your chin and everything. It's really very uncomfortable. Yep. I had a patient come in one time. He had a Holter monitor, and how did I know? Well, he had wires sticking out like this. He was wearing a sweater. It was cold. You also want to tell him avoid magnets and metal detectors. I told you about the electrical blankets. After the test, it's real easy. All he's got to do is just remove all the electrodes, just wrap up the Holter monitor and bring it back along with the book. That's all he's got to do. Very easy. Holter monitors are wonderful things. Okay, let's talk about cardiac cath. Go back. Holter monitors are wonderful things. They're non-invasive. Do you need a consent? No. Do you need a signed consent? No. Okay. Cardiac cath or an angiogram. Well, you're using a radio-opaque dye to visualize the left side of the heart. Okay. Is this an invasive procedure? Yes. Do you need a consent? Yes. Who obtains the consent? The doctor. Please, the doctor. The cardiologist. Please say that. Okay. And you are just what? Witnessing the signature. Yes? Okay. Now, what are some of the complications of a cardiac catheter and angiogram? Remember, know what you're doing. Know what's happening. Okay? You're going to go in through the femoral area. Usually the femoral area, sometimes the brachial. But you're going into an artery. Okay? And what does an artery like to do a whole lot? It loves to bleed. It just loves to bleed. So you're going into an artery and you're going all the way up into the heart, right? So you're going... what cavities are you passing? You're passing the abdominal cavity, and then you're passing the thoracic cavity. So can you have an oopsie here? Sure you can. Can you puncture? Yes. So your job is to watch for possible complications afterwards, and you got to watch here, thoracic and abdominal. Okay? Because can we give him a pneumothorax? Sure we can. I mean, it's the present, it's free, but some people just are so ungrateful. Anyway. That was a joke. Why? Unbelievable you are. Okay. So what's the purpose of the cardiac cath? Now we know that we're going up, right? And we're going to go look in the heart. Well, what's the purpose? Why are we going in the heart? Well, we really want to look at the blood supply of that heart, right? We want to see if there are any anomalies, congenital or otherwise. And we also want to check the valves. Can you look at the valves? Yes, you can. You can look and see if they're stenosed or not. So that's, the purpose of the cardiac cath. Well, what's your nursing care? Well, in the ideal world, which NCLEX lives in, your NPO 6 hours before. That's the ideal world. I'm here to tell you that in the ER, most of the times it's come in, he's got chest pain, he just ate, whoop, up to the cardiac cath lab. Okay? We don't care if he's NPO 6 hours before or not. This is an emergent procedure now. All right? But in the NCLEX world, you plan for the cardiac cath, right? Your NPO 6 hours before, you want to check if he has any allergies. But, right? Now he's going to tell you no.